Clinical presentations are groin pain. The pain may radiate down the medial aspect of the thigh towards the knee. Weakness of the muscles, which are mainly supplied by the obturator nerve. Difficulty with ambulation. Adduction and internal rotations are affected. Externally rotated foot may be present during observation. Wasting of the adductor muscles of thigh and diminished sensation. These are the clinical presentations of obturator nerve injury. You may find the complaint of groin pain when you ask the patient about the chief complaint. Wasting of the muscles or weakness of the muscle may be found out during MMT examination. Difficulty of ambulation may be seen during observation of gait. Adduction and internal rotation range of motion will be reduced, which will be found during range of motion examination. Externally rotated foot may be seen during observation. Wasting of the adductor muscles also can be seen during observation, and diminished sensation will be found during sensory examination. What are the main goals for physiotherapy management for obturator nerve? It is similar to other nerve injuries, which is to reduce pain, prevent complications, that is stiffness and tightness of the muscles, maintain and increase muscle strength and range of motion, improve sensory function, educate the patient to protect the denervated skin, especially from burns and pointed objects. Ultimately, the main goal of physiotherapy is to improve activity of daily living of the patient. The treatments are similar to other nerve injuries, such as for reducing pain, we can use TENS, massage, ultrasound, laser therapy, cold pack, etc. To improve range of motion and to maintain range of motion, we can use passive range of motion exercises, mobilization of the hip joint, stretching of the adductor or abductor muscles to maintain the range of motion, and also hamstrings. And we can start strengthening the adductors according to the MMT finding. If the MMT is grade 0 or 1, we will use electrical muscle stimulation. If the grade is 2, we will use suspension therapy. So for suspension therapy, patient has to be in supine lying position. For suspension therapy of adductor muscles, patient has to be in supine lying position. The lower limb will be suspended on the sling, and we'll ask the patient to adduct the hip joint towards opposite lower limb. So for progressive resistance exercises, we can use theraband or resistance against the movement of adduction. So you can see the picture, the weight is tied on the distal component of the lower limb, and then patient is asked to adduct against the weight. Next, we can use weight cuff. Patient can be in supine lying position. We'll ask the patient to flex and adduct. So for these exercises, patient's flexor muscles should be strong enough to flex the hip and adduct and abduct the hip joint. Next nerve entrapment we'll discuss about is lateral cutaneous nerve of thigh. So once this nerve is impinged, it will give us symptoms of pain and numbness to the lateral aspect of the thigh, which is also called as myalgia paresthetica. The other name for it is Bernhardt-Roth syndrome. So the nerve involved is lateral cutaneous nerve of thigh. You can see the nerve which is arising from the lumbar plexus, and then it enters the pelvic cavity, passes under the inguinal ligament and supplies the lateral part of the thigh. The common causes for lateral cutaneous nerve compression is inguinal ligament compression, wearing tight trousers or belt which will compress the lateral cutaneous nerve of thigh under the inguinal ligament. During pregnancy, the lateral cutaneous nerve of thigh may be compressed or because of the overweight. The clinical features of lateral cutaneous nerve or myalgia paresthetica are pain, burning and numbness over the front and lateral part of the thigh, sensitivity to light touch over the outside of the thigh, increased symptoms when wearing tight belt, work belts or tight waist clothes. It will also show positive symptoms if we compress the pelvis, that is called as pelvis compression test. We'll ask the patient to lie in side lying position, and then the therapist will compress the pelvis at the area of ASIS, and the patient will complain of tingling and numbness. If patient complains of tingling and numbness, then pelvic compression test is positive. Tenal sign, that is tapping of the nerve just below the inguinal ligament, also may produce similar symptoms, which is called as tenal sign positive. And direct compression to the nerve by the thumb or finger also can produce similar symptoms. How can we manage the meralgia paresthetica? Mostly we have to prevent meralgia paresthetica by avoiding use of tight fitting clothing or belts. If there is a recent weight gain, then we have to teach the exercise programs to the patient, and we have to provide the dietary chart to the patient to lose weight. Stretching of the muscles, that is mainly tensor fascial lata, and soft tissue therapy such as active release technique or deep tissue massage may provide relief of symptoms. So active release technique is a technique where we ask the patient to contract the muscle against the resistance of the therapist. Patient has to hold that position for some time and then relax. So during this time the muscles will go for relaxation. Deep tissue massage or deep transverse friction massage, we already know that we will be giving a massage which will be perpendicular to the fibers of the muscle to release adhesion or tightness of the muscle. Tense nerve glidings and ultrasound can be given to reduce pain. Cold pack therapy also will reduce pain. Kinesio taping can be applied on the lateral aspect of the thigh to pull the tissue proximally so that the stretching of the nerves may be reduced.